One surgical option to relieve pain is a decompression. What is that?
Generally, if you're just doing a decompression alone, the patient's issue is stenosis, or so narrowing around the spinal cord or nerves. That can manifest with sciatica. It can manifest with claudication. But what you're trying to do is alleviate the nerve pinching. And so you are carving away bone, you're trimming the joint, you're taking away the ligament at the affected levels to unpinch those nerves and in that way provide relief.
What exactly is a spinal fusion operation?
Sometimes you do a fusion in concert with the decompression, but a fusion operation is indicated when there is instability or deformity of the spine. And sometimes, if the patient's nerves are pinched very severely, sometimes doing the fusion affords you the opportunity to do a larger, more aggressive decompression than you could do otherwise.
And what about a discectomy? What is that type of surgery?
So that's a very limited decompression operation. So you identify typically a disc herniation, access it with disrupting as little tissue as possible, remove the disc herniation and leave everything else. The implant that you put in is basically two metal shims with some cleats to keep it in place and a plastic dome that it rotates and rolls on.
What words of encouragement would you offer a patient that's facing a back surgery?
So some people can get intimidated or scared of back surgery, and there's plenty of reason why, and I think it's justified. But what I would say is that when you're doing surgery for the right reasons, the correct indications on appropriate patients, they largely do better. They have historically good to excellent outcomes. And I would also say that for patients that may have just recently underwent surgery, that progress is not linear. There will be good days and there will be bad days, and trying to measure your progress day to day can sometimes be discouraging. But nerve recovery is really protracted and prolonged. And so I tend to tell patients to look at things longer term. So see where you are now versus 3 months ago and 12 months ago, and look at your improvement.